morning, everyone. My name is Hadil Zainal, a student nurse from Davao Doctors College. So today, I'll be performing the assessment of cardiovascular system return demonstration. So prior to performing the procedure, first, review the client's medical record and check the doctor's order for the need to perform the assessment. Determine the scope of assessment needed, prepare necessary equipment, perform hand hygiene, and of course, use a clean gloves as necessary, and observe other appropriate infection prevention procedure. So now, I'll review my client medical record. So, as I observe, this is the first assessment of my client. Also, the necessary things and equipment that we need in this assessment are, of course, the stethoscope, centimeter ruler, the pen light, the cardboard, and a small pillow. So, before doing the assessment with your patient, greet the client politely and the client companion if around. Introduce yourself and verify the client's identity. Ask how the client would like to be called during the assessment and establish a rapport with the client. Explain the procedure to the client and how he or she can participate during the assessment. Provide the client the opportunity to clarify and ask or raise any concern, and ensure the client's comfort, privacy, and confidentiality. Drape the client's body as needed throughout the assessment. Inquire if the client has any existing and history of cardiovascular problem, as well as lifestyle habit and our risk factor of cardiovascular problem. So, good morning, ma'am. I'm Hadil Zainal, your student nurse for today. May I see your wristband, please? So, please state your complete name.
Cardia Patadon,
Your birthday, please.
March 17, 2002.
Okay, thank you. So, what would you like me to call you?
Far.
Okay. So, Miss Far, so today we will be doing the cardiovascular assessment, whereas I need to check your heart if there's any abnormalities. Also, I need to touch some part of your body, especially your upper and your lower extremities. Do I have any permission to do that to you, ma'am?
Yes.
Okay, thank you so much for that. So, as you can see, I close all the curtains to protect your comfort, privacy, and confidentiality. So, do you feel comfortable right now?
Yes.
All right, thank you. So, ma'am, I have some question for you. Is that okay? Okay, so ma'am, for your information, the information that I'll be getting to you is secured and safety handed to the doctor. So, ma'am, do you have any problem of oxygenation with oxygenation? Do you feel shortness of breath or chest pain?
No.
Okay, thank you. So, do you smoke? Do you drink a lot of liquor, alcohol?
No.
Okay, thank you. Do you have hypertension?
No.
Okay, thank you so much for that. So now let's proceed to the working phase. Stand at the right side of the client and position the client's supine with the head of the bed elevated between 30 to 45 degrees, making sure that the head and the torso are on the same plane. Instruct the client to turn the head slightly to the left and shone tangential light source into the neck, suprasternal notch, and the area around the clavicle to observe for pulsation and shadow. So, ma'am, can you turn your head slightly? Just like that. Okay. If the jugular distension was noted, assess the jugular venous pressure or the JVP by locating the highest visible point of distension of the internal jugular vein. Emphasize the distension with tangential lighting. As deemed necessary, raise or lower the head of the bed 30, 45, 60, 90 degrees until the highest visible point of distension of the internal jugular vein was observed. And also, measure the vertical distance in the centimeter above the external angle by extending a long rectangular object or a card horizontally from the point and centimeter ruler vertically from the external angle, making exact right angle. And also, repeat the preceding step on the other side. So, as I observed through your findings, your vein is function normal. Your veins is visible and it's function normally. So, all it's normal. So now, let's proceed to the assessment of carotid artery. So with the head of the bed still slightly elevated at 30 degrees, position the client's head slightly towards the side being examined. Palpate the carotid artery, cautiously avoiding too much pressure or massaging the area. And also, repeat the preceding step to the other side. Okay. Okay. Okay, so after that procedure, turn the client's head slightly away from the side of being examined. Place the bell of the stethoscope over the carotid artery. Ask the client to hold his or her breath for a moment and auscultated the carotid artery, listening for birth. If the bruit was heard, and gently palpated the artery to determine the presence of the trill. And then repeat the preceding step on the other side. So now, ma'am, can you turn your head slightly so that I can hear your breath sound? So now let's proceed to the assessment of the heart, the precordium. So begin with the general inspection of the chest wall. Keep the right chest draped. Gently lift the breast with the left hand or ask the patient to do this for assistance. Stand at the right side of the client with the head of the bed elevated at 30 degrees and look for any abnormal pulsation. Shown a tangential light across the chest wall over the cardiac apex to make this movement more visible. So, So, after this procedure, simultaneously inspect the precordium of pulsation while palpating the aortic area, pulmonic area, tricuspid area, and the apical area following the technique. Palpate the hips and lips using the palm and hold the finger pads flat or obliquely against the chest. So now, okay. Okay, so for thrills, press the bell for the hand firmly on the chest to check for a buzzing or the vibratory sensation caused by underlying turbulent flow. So, ma'am, again, I'm gonna... Okay. And now, palpate the impulse using the finger pads flatly and obliquely on the body surface from the aortic area, pulmonic area, and the tricuspid area. Ma'am, again. And palpate, if unavailable, palpate the impulse using the palmar surface of the 2 to 3 middle finger. Then the finger assessment, palpate with one finger alone to confirm the characteristic of the apical impulse, noting to location, diameter, and the amplitude. If unavailable, palpate the apical pulse with the patient supine. Reposition the patient to the roll partly onto the left lateral side. Palpate again using the palmar surfaces for several fingers. If it's still unavailable to palpate, ask the patient to exhale fully and stop breathing for a few seconds and palpate again while patient maintains to be partly facing his left side. And next, inspect and palpate the epigastric area at the base of sternum for abdominal aortic pulsation. So, and now let's proceed to auscultation to assess of the heart rate and rhythm by placing the diaphragm of the stethoscope of the apex and listening closely to the rate and rhythm of the apical impulse. Count the heartbeat for the full minute. If an irregular rhythm was detected, assess for a pulse rate deficit. After that, use the diaphragm of the stethoscope first, then the bell auscultated the heart in the all four automatic sides: aortic, pulmonic, tricuspid, and apical, mitral for heart sound, extra heart sound, and murmurs. Ask the client to breathe regularly while auscultating. Kiman, can you inhale and exhale? Then, repeat the preceding step while the patient is in the left lateral position, then at a sitting position. leaning forward, and briefly stop breathing after an exhalation. So, ma'am, can you position the lateral side? Okay, so when I touch your wrist, can you inhale and exhale? So, ma'am, can you sit down? Okay. So, can you inhale and exhale? Okay, so have it bend forward. Okay, so can you inhale and exhale? Okay. Okay, you can now lay down. Okay. Okay, thank you so much for that. So I haven't seen any abnormalities to your breathing sound, and also I've seen all it's normal. So now let's proceed to the assessment of the peripheral vascular system. So assess each arm from size, symmetry, skin color, and temperature from fingertips to shoulder. Noted for any presence of edema, lesion, changes in skin texture, and hair distribution. So next, inspect the peripheral veins in the arm for the presence and or appearance of a superficial vein when the limbs are dependent and when the limbs are elevated. And now palpate for the radial pulse, ulnar pulse, and the brachial pulse individually and bilaterally. So now going to palpate your ulnar, radial, and brachial pulse. So, okay, can you inhale and exhale? Okay. Okay. Okay, to the other hand. Okay, can you inhale and exhale? Okay. Okay. Okay, thank you. And next, assess for the capillary refill. And repeat the preceding step to the other arm. Mhm. And also perform the Ellen's test. And also repeat the preceding step on the other arm. So can you make a fist like this? Okay. Okay, can you inhale? Okay, can you open closely? Can you see the redness? Yes. Okay. The other hand, can you make a fist? Can you inhale? So now let's proceed by examining the lower extremities. At the supine position, assess each leg for size, symmetry, skin color, and texture from gain to toe. Noted for any presence of lesion, changes in skin texture, and hair distribution. Inspect the peripheral veins in the legs for the presence and the appearance of superficial vein when the limbs are dependent and when the limbs are elevated. And also palpate for the femoral pulse, popliteal pulse, dorsalis pedis, and posterior tibialis individually and bilaterally. So ma'am, now I'm going to palpate your. So now I'll be going to palpate your femoral pulse.
See there? On the other side.
So now, assess the peripheral leg veins for sign of ulceration, varicosities, and tom and thrombophlebitis. And also inspect the calves for ulceration, varicosities, redness, and swelling over vein site. Palpate the calves for firmness or tension of the muscles, the presence of the edema over the dorsum of the foot, and the areas of localized warmth. Push the calves from the side to test the tenderness. And firmly dorsiflex the client's foot while supporting the entire leg in extension, woman's test, or head the client's stand or walk. Ganun. Okay, so now I'll be palpating your okay, so can you So now we're in the summary, the closing phase. Inform the client assessment was done. If deemed necessary, assess the client to change cloth. Reposition the client's comfortably setting in the chair. Summarize the information obtained during the working phase and discuss finding to the client. Discuss the client possible plans to resolve health concern if present. Assist for the client understanding of the plan and need to further teaching. Provide the client's opportunity to clarify and ask or raise any concern. And also, thank the client for his or her cooperation and ended the assessment politely. Done after care, perform hand hygiene. And don't forget to document the findings in the client's record using the printed or electronic form or checklist supplemented by narrative notes when appropriate. So now, ma'am, we're done with our assessment. Based that I've observed in your findings, your upper and your lower extremities no abnormalities. Basically, it's all normal. Ma'am, um, do you have any concern and clarification?
Mm.
Okay, thank you so much for that. And also, ma'am, don't if you have any concern, don't hesitate to call me and to come back here to provide the assessment for you. And ma'am, thank you for cooperating this assessment. And also, I'll see you around and have a good day.